Many patients come to us saying, Doctor, I am feeling anxious all the time. My mind is restless and sleep is disturbed. But medical reports are normal. What is often missed in this? Anxiety is not always primarily a mental or psychological disorder. It is often a secondary manifestation of disturbed gut physiology. Let us understand what is the connection between mind and gut to modern science as well as Ayurveda. First of all, what is anxiety? Anxiety is nothing but the excessive apprehension, that is, having some excessive thought about something which has to happen in the future, which is not yet happened. It is a that knot in your stomach. It is also associated with some of the physical complaints like palpitation, muscle tension, restlessness, gastrointestinal discomfort, and of course the disturbed sleep. Now let us understand how anxiety is not just a physiological condition, and it is a neuroendocrinal and gastrointestinal disease as well. Recent research has established a bidirectional communication system known as gut brain axis. This communication occurs through the vagus nerve, neurotransmitters, gut hormones, immune mediators, and even the gut microbiota. Some clinically important facts are 90% of the serotonin produced in the gut. Gut also produces dopamine as well as the acetylcholine, then GABA. Chronic gut inflammation increases the cortisol level. Dysbiosis is strongly associated with anxiety and depression. Now, let us understand the mechanism between the gut and the brain and how these chemicals are playing a role in the anxiety. First of all, the very important factor is about the gut inflammation, how the gut inflammation occurs and how does it act and causes uh, various changes in terms of the chemicals of our digestive system. First of all, the poor digestion and indigestion irritates the intestinal lining because most of the times that undigested food remains in the gut and starts getting fermented, and because of that its acidic nature increases. If the food contains some excessive alkaline contents, it also increases the inflammation of the gut lining that activates the local immune cells in the gut. The immune cells causes release of pro-inflammatory cytokines like IL-6, then TNF alpha. These cytokines in turn stimulates the hypothalamic pituitary adrenal axis. The adrenal glands respond by continuously releasing the cortisols. And because of this, clinically, patient starts getting uh, disturbance in its day-night rhythm and causes a persistent fight and flight mode of the body, which causes anxiety even without having any situation. As I said earlier, 90% of the serotonin is produced in the gut, and it is produced by the enterochromaffil cells of the gut. These cells depends on the healthy lining of the gut and a balanced microbiota, as well as the adequate tryptophan metabolism. During gut dysfunction, inflammation damages the enterochromaffin cells. Dysbiosis diverts the tryptophan into inflammatory pathways, which results into the erratic serotonin levels. Now, melatonin, which is responsible for the proper sleep, depends on the serotonin levels. When the serotonin levels goes haywire, at melatonin levels get disturbed, and because of that, the sleep of the person gets hampered. And because of this imbalance between serotonin as well as melatonin, the overall circadian rhythm gets changed and gets disturbed, which at the same time, from the other hand, the cortisol level has also increased, which causes the disturbed sleep. So at the same, that means the sleep is hampered, the digestion is already hampered, the gut has got inflamed. All this causes this entire disturbance in the gut microbiota, in the complete digestion, and the chemicals related to the digestion, which disturbs the entire nervous system. Gradually, these cytokines get, starts causing the leaky gut, that is uh, permeable intestines, which causes the entry of the cytokines into the bloodstream, which crosses the blood-brain barrier and starts disturbing the brain and the nervous system. And this is how the entire nervous system starts getting involved into the anxiety part. So this is how it is, as per the modern science, that anxiety is a disease which starts most of the times from the gut and ends up into the nervous system and the brain, and starts getting the emotional disturbance or a psychological disorder. Because of this, person starts getting mood swings, the palpitation, restlessness, disturbed sleep, abdominal discomfort. Many patients starts getting the symptoms of IBS, that is irritable bowel syndrome. People has to go for motion or the defecation almost 5 to 6 times a day, and even then they are not satisfied, and they're mentally stuck in their abdomen. So such kind of disturbances happens over a period of time. If this is not restricted in time, then it also takes a toll on our skin, and skin gets hampered, and the autoimmune pathology starts getting rolled over. Because of this, the overall autoimmune starts showing its results and manifest into different diseases. As per Ayurveda, Ayurveda gives a lot of emphasis for the metabolism. When we talk about the metabolism, digestion has an important role. And whenever there is an disturbance in the digestive process, the first thing happens is the toxins in the form of the various chemicals starts getting aggravated. Like I have mentioned, that pro-inflammatory markers or the pro-inflammatory cytokines like interleukin 6 and TNF alpha. Because of this, Aama produces, and these toxins gradually starts getting associated with the Vata dosha. That is nothing but the nervous system. The nervous system has a close relation with the emotional health of a person, and that is how, when it starts with the Agni, that is digestive process, and then it lands into the Aama, that is toxins, which hampers the nervous system over a period of time, and which hampers the emotional health of a person. This is how the anxiety is explained in Ayurveda. And now let us come to the solution, how the anxiety has to be taken care as per the Ayurveda. So why I have mentioned about all these factors, how the digestive system gets disturbed, and then it has a linking with the gut brain axis as well as the hypothalamic pituitary and adrenal axis. Because if we just keep on concentrating on the mental factor or the psychological factor at the time of treatment, this disease is not going to get cured from its root. If at all we have to treat it from its root, we have to first take care of the gut. And to take care of the gut, there are steps of the treatment in Ayurveda. The first step of any disease is Amapachan. We have to do Amapachan with certain medicines, with certain therapies, which is called as Rukshana or Ampachan. After this, the Agni gets normal, and because of that, the oral digestive process starts getting normalized. After this, then we should not stop here. We have to remove these toxins out of the body, and then we have to do various detoxification processes for that. One of that is Vaman, Virechan, and most importantly, the Basti. These are the three important Panchakarma procedures or the detoxification procedures responsible to rinse out the toxins in our body. Once we are clean, or we made the system clean with the help of these detoxification processes, then there is a role of strengthening the system, and then we have to give some herbal and herbal medicines. Uh, After that, we have to give a maintenance dose of the Rasayana Aushadhi. This is how Ayurveda looks at it to treat this disease from its root. Now, coming to the exactly pinpoint anxiety treatment, which is known as Vyadhi Pratyanika Chikitsa in Ayurveda. That means the treatment which is hitting to the disease. But this can be done only when we have taken care of the root cause of the disease. Out of that, one very famous treatment is Shirodhara, in which the medicated oil is poured on the forehead of a person for certain time. Along with that, the Nitya Abhyanga, that Ayurveda believes in doing Abhyanga, that is oil massage every day. Because of this, the Vata gets pacified. And once the Vata is pacified every day with the oil massage, then the routine of the circadian rhythm gets in balance again. Apart from that, when we do these detoxification processes, there are multiple fermentation processes in which we do uh, the rice potli massage, then leaf bundle massage. Uh, there is one process called as spiritual, in which we have to do the bathing of a person with the medicated oils. So all these various processes of detoxification, as well as the nourishment treatments, the overall nutrition through the diet, through the medicines, has to be taken care, and then we can say that we have treated the anxiety or taken care of the anxiety completely from its root. And this is how Ayurveda looks at it in a very holistic manner. You must have heard many a time that after detoxification person gets rejuvenation, but how does that happen? As per Ayurveda, digestive juice is known as rasadhatu, and once, because of the proper digestion, the digestive juice is normal, or which is having a very nourishing properties in it, then that rasadhatu will also nourish the mana, that is mind. Once the mind is nourished properly, then the strength of the mind will be increased, and because of that, that fear factor which is having in the anxiety will be reduced, and its courage of the mind will be increased to deal with the situations. And after this, if we have to maintain all these things, we have to maintain this with the help of various medicines and dietary corrections. At the same time, we have to do the lifestyle correction, and apart from that, to maintain that, there are certain sets of medicines called as Rasayana Aushadhi in Ayurveda. So those medicine has to be continuously consumed. If we do all these things systematically under guidance or under observation, then definitely the anxiety and all the various complications related to the gut and anxiety are definitely taken care from its root. Thank you so much.